welcome to the We Talk Health Podcast, the official podcast for West Tennessee Healthcare. Please be advised that this podcast is not intended to replace any medical advice. Always follow your medical professional's advice and direction. Nothing said in this podcast is intended to supersede or supplement the direction of your medical caretakers. If you have any questions, please reach out to us at wetalkhealthpodcast@gmail.com, and we will do our best to answer any questions you may have.
Welcome to another episode of We Talk Health. My name is Will Cashagro, and we're here again today in Dyersburg, Tennessee at Sports Plus Dyersburg. We are with JoBeth Cook. She is a speech-language pathologist. We also have Matt Coleman, who's a physical therapist, and Ms. Kathy Sudbury, who is the marketing manager of Sports Plus. How are y'all today?
Doing very well.
Good. Thanks for coming on.
Thanks for having us.
Absolutely. So today we're going to be talking about LSVT, big and loud. So what exactly is that? That's a lot of letters and words that you wouldn't really think that would go together. So what is that?
LSVT, it stands for Lee Silverman Voice Treatment.
Okay.
And it was developed to target patients with Parkinson's disease.
Oh, okay.
And as they were moving along, they also created the BIG, which correlates with physical therapy.
Okay.
Today what we're going to be talking about is this is specific for Parkinson patients.
Gotcha. Okay.
And newly or recent diagnosis, or it can be later in the stage of Parkinson's, but
Sure.
we do like to bring them in as early as we can. What we'd like to talk about, because with Parkinson's, and our therapists will tell you, everything starts getting enclosed in their movements, their sound is all smaller, and that's why it's called big and loud.
That makes sense.
I'm going to let them do a little more detail about why, if you have a family member or yourself with Parkinson's, you really want to start this.
As JoBeth said earlier, the LSVT BIG program has been around for a while. The voice treatment came on initially, and then the BIG program came later on. And it's basically the same thing, the small amplitude of movement and the small amplitude of the voice, the response is the same. So the movement gets small, the voice gets small, and so trying to calibrate that by the protocol that we have can really increase their movement and improve their mobility.
And for the loud, for speech, it improves their vocal quality. Some of the patients that we have, they may feel socially isolated, or they feel like they don't have a voice anymore, and so they're very quiet. They have a very soft voice. So we want to give them that empowerment to live better and to improve their vocal quality.
Because in the past, once you're diagnosed with Parkinson's, there's really no treatment. And that is the beauty of this program. Our people, most people don't realize, they had to do a certification in order to even practice this part of therapy, because it is so unique and it does help. What they're teaching to the patient is almost like they're retraining the brain to think more, and it's through therapy with, like, for example, on the speech side, JoBeth would sit down and work with them. You may hear her talking extremely loud, but yet the patient doesn't hear it that way, or out of his mouth either. Is that correct, JoBeth?
Yes. With Parkinson's, the mobility, it does get smaller. So they think they're talking in a normal voice, but the rest of the world is hearing a very soft voice.
Sure.
So when we're doing the loud treatment, they feel like they're yelling, but they're producing a normal voice, if that makes sense. So we're teaching them with that calibration. And
Yeah, one of the key components is recalibrating what they feel.
Yes.
So every day they get up and they have an excessive amount of tone. Just, like after you work out, you feel the muscles kind of tighten up, that tense feeling. They feel that all the time, and that they call it rigidity. So that tone in their legs and in their arms, really all throughout their body, that tone makes their movement smaller than what they feel like they're doing. So in order to take a normal step, they have to provide a more than normal effort to create a normal step. And so what we work on is that calibration for them to know what it actually takes, how much effort it takes to take a normal step, so that they don't catch their toe or so that they don't fall. And so that calibration is a huge component of it.
If I were to have, say, a family member that has Parkinson's, how do I get over to you guys, and what's that treatment going to be like?
we will receive a doctor referral a prescription for a speech and PT evaluation and treatment. And what we'll do is we'll get them in. We will assess to see if they're appropriate for loud, for me, and for Matt for the big program. The program is itself, it is high intensity. It's a 4-week, 4 days for 1 hour treatment. There's a 30-day homework assignments, and there's a 30-day carryover. They'll come in, we do the treatment, we work on the calibration, and we follow up.
Yeah, for sure. And the goal is to have these patients be able to carry that over to their normal function. So when they're doing their normal daily activities, that's why we have the carryover tasks, so that each day we're giving them new carryover tasks. So for the big part, it would be opening a door. Every time you open a door, I want you to open it big. And so, that translates to them being having functional improvements. Now, like you said, Parkinson's is a progressive disorder, so we're not going to keep that collectively from getting more difficult over time for them. However, their daily function will definitely improve by calibrating their movement and knowing what a big movement, how much effort it takes to make a normal movement. So we can definitely improve that. It is a high intensity program, and typically with any of the research that you read, the most successful programs for Parkinson's disease all include some type of high intensity. Now that intensity looks different for everybody. The big program has done some changes. So initially it was all they had 2 seated exercises, and then the rest were standing exercises and functional activities. They've now changed that to where there are some, you can do the whole program in sitting or the whole program laying down. So a lot of times we get that. We get people who are concerned that, hey, this is a high intensity activity. I'm not going to be able to participate in that.
Well, you just answered a question I was about to ask you. You keep saying high intensity. To me, I'm thinking aerobics. I'm thinking I've got to move fast.
Right.
And if I've been diagnosed with it or have had it for, a year, I'm thinking, I can't do that. But that's just a clinical term that has been for you guys, where high intensity is the term, but for the patient, it's not really high intensity. It's just moving a different way or speaking a different way and trying to teach them that you've got to remember to do this, correct?
Absolutely. And I think effort's probably a good word for that. They say big effort, have a big effort, take a big step. For them, that may it may look different for everybody. But it will feel the same as far as a big effort and the intensity of what they're providing as far as an effort.
And with loud, I've had a few patients thinking, well, I'm screaming. That's not it. It's think loud, speak loud. You're just kind of going a little bit more effort, putting a little bit more effort, and making sure we have a good vocal quality.
Yeah, and I get people that are afraid they're going to look strange because some of these exercises don't look normal. They're not normal movements.
No, I can say that. I have seen you guys do this.
Yes.
And to see the therapist, you guys are taking these huge, big steps. And I'm thinking, what in the world? Or like I said, I've heard JoBeth, scream, it sounds like. But to that patient, they're not really doing that, even though we're seeing you do it. It's triggering that mind to think big. Take that bigger step. Take that bigger speech. But I have seen that, and it does look like, I'm like, what are they doing over there? But in the terms of the person with this disease, it is helping that mind to remember to do this.
Absolutely. And the goal is to end up in a normal gait pattern, and unfortunately we have to really work hard to push beyond what's normal to kind of come back to normal. And so they have to know what the extremes kind of feel like. But yeah, so that's definitely a concern though. They're worried that they're going to look strange out in public. We're like, no, we want you to look normal. We just
and you will
know.
look normal. It's just in our setting. And
For
go
sure.
back over how, and I mean, I know when they say high intensity, it's how many times a week and for how long?
Sure. So 4 times a week for 4 weeks in 1 hour each session. So a total of 16 sessions, 16 hours with carryover every day.
And we need them committed to do that so
Yes.
they can
For
see the
sure.
improvement.
For sure.
So give us an example of someone you've had recently and the outcome, and what did that patient think?
Sure. So I had an elderly lady that came for therapy and just had an incredible work ethic, and she made some significant improvements. One of the things that she had the most difficulty with was what we call freezing. So most of not all of Parkinson's patients, but many of them will experience what we call freezing. So where they're walking and they just get stuck. They can't take that next step, or they go to turn, or they walk through a doorway or over a threshold and they get stuck there. And that was one of the biggest things that we worked on, was some techniques to say 1, 2, 3 step, just to get that cycling through their mind, to be able to step when they want to step and not get stuck. Before we started, she said that she would get stuck she got stuck in a parking lot one day trying to go into a store and just could not get in. And so that went from, freezing for maybe a minute of being stuck standing in that one position to, she would have a cue of big step, ready, set, go, or some kind of verbal cue that she would go through in her mind that would help her to take that step to, from a minute to maybe just 2 or 3 seconds. And the goal is to try to get that to where we don't freeze at all. We can walk and do normal. But that was one of the ones that really stands out in my mind.
That's amazing. That is amazing. What about in the speech side?
I've had a few. They've all done really great progress with the Loud program. The one I'm thinking of, she came in and she had a lot of stuttering. There was stuttering, and she would talk really fast. And she also had that quiet voice, and so it was hard for her. And she loved to go to McDonald's with her husband and with her friends, but she felt like she couldn't talk, and that it was hard for other people to understand her. So with the Loud program, she was able to reduce that rate of speech. I could understand her 100% of the time. That vocal quality increased. She loved the voice, and her crush was Blake Shelton. And so I got pictures of Blake Shelton, and she would sing her heart out to get that good vocal quality. Yeah. So we try to, that's another thing with our patients, we find what's motivating them. For the Loud, they feel like they can't talk to their family. So being able to call their grandson or granddaughter and be able to talk to them, those are the things that we kind of work on, just finding out that motivator to improve.
That's one thing that I've noticed with any person that I know that works at Sports Plus is when they're taking care of their patients, it's not like a one-size-fits-all program. You find the patients who have, Blake Shelton's my motivation, or Beyonce is my motivation. It's as weird of an example as that might be, it's very specific to the patient that you're working with, and it's very specific to those people that you essentially try to incorporate into your own family, because you want it to be like a family environment, and you're doing that, and that's really cool. We
are very proud that our therapists go beyond just being a therapist and doing a daily routine and being complacent. They take the time, and a lot of this they pull out of the evaluation. So when you come in and they are talking to you for that first visit, what they're doing is finding out your likes, your dislikes, what's your limits, what's going on with your body. It may seem like we're asking you way too many personal questions, but what it's doing is loading these therapists with the right information on how to take care of you. And that is one blessings we have with our Sports Plus therapists. I brag on you guys all the time. So we've had great responses with our Parkinson's. And the reason we're doing this podcast is we want people to realize that we have people out there that are certified, that have sat through this. And the LSVT program is very specific on who can apply and who can't. So again, we are truly, truly blessed that several of our locations have this. But if you're listening in the Northwest Tennessee area, we want you to know that it is right here at your fingertips, and there's no reason to be embarrassed. Come on in, and can we go ahead and have a self-referral if the doctor's not sending them to us? Because this is something I personally am working on with physicians to understand. We have therapists to help them, and that some doctors are a little slower to refer, but it's getting better. But are they able to self-refer themselves and come in, and then we work with that doctor?
I mean, I think we could.
Yeah, for sure. It depends on insurance, and we can. If you have questions about that, you can always call. We have our front office staff is great at knowing who can be a direct access patient and how that process works. That the referral can come from a neurologist, it can come from your primary care physician, nurse practitioner. That's all fine. And if you have questions, we love to talk to patients about that too, because a lot of times people they have questions about this. They see the videos online or the commercials, and there are a ton of good treatment options out for Parkinson's disease. There's a ton of research. This has been going on since 1987 when Dr. Lorraine Remig founded the program when she saw Miss Lee Silverman, and that's kind of where it started. So it's over 25 years of good quality research that's gone into, especially the loud component. That's where it started, but then Even in 2010, there was a great article that talked about the efficacy of the BIG program. So it's been around for a long time. A lot of research-based evidence behind the program. And, a question that people would ask, well, why can't I just go to physical therapy? And you definitely will make some improvements. There are some key components to the BIG program and the LOUD program that I think are really, really important, and you may or may not get just by going to any physical therapy clinic. Amplitude of movement, so making really big movements is key. All the components of the BIG and LOUD program are really specifically catered to the Parkinson's disease patient. All of the components are specifically designed for the Parkinson's patient. So it's really a program that I think is above and beyond most all the other. LSVT program is definitely one of the best ways to kind of regain that functional mobility. And there's a lot of research for that.
Is there anything else before we end our podcast that you guys would like to touch base on that we need to discuss and make sure everyone understands it?
With the LOUD and BIG, we do recommend follow-up appointments to make sure that they keep those skills and we're not regressing or losing those skills, because it is a progressive disorder. We want to make sure that they're still functioning as well as they can be. So kind of like when you go to a dentist, it is recommended, to go to the dentist every 6 months. To make sure everything is okay. Well, same thing with us. We recommend a follow-up every 6 months just to make sure. And sometimes we might have to do just a couple of sessions just to, remember, recall all that information, and then they're fine. And then we touch base again. Yeah. So
that is awesome to know that we're not just...
We don't just leave you.
Thank you. That is awesome. And want the patients to know, please call. If you are feeling or a family member sees it, I wouldn't say regression because it's progressive disease, but we're noticing it's taking over more, that we can still come back in here and get a refresher and get that brain to thinking again.
Yes.
If I was a patient, what would the number be for me to call?
So you can reach us at 731-286-1115, and that's us here at Sports Plus in Dyersburg.
Okay, and in the description of this podcast, I'll also link the Sports Plus page to the West Tennessee Healthcare website, so if you have additional questions, you can check that page out as well. Well, you guys are doing the Lord's work. Thank you for what you do, making Dyersburg a great place to live and receive health care. People out there, remember that you don't have to go to bigger cities to get physical therapy help. You have it right here in Dyersburg. There are 14 different locations in West Tennessee for Sports Plus, so if you ever have any questions, you can check any of them out. They will all be very helpful. Thank y'all so much, and this has been another episode of We Talk Health.
We have 14 convenient locations to serve you, so if you're experiencing any type of pain or if you just have a simple question, if you'd like to give us a call, you can call us at 800-427-0957. We have 5 in Madison County. That would be our Sports Plus North, South, our Sports Plus Aqua Therapies, Lift Therapy, and Work Plus Rehab. Yes, Lift Therapy is part of our Sports Plus, so keep that in mind as well. If you also are living outside of the Jackson area, we have Sports Plus Alamo, Brownsville, Dyersburg, Henderson, Humboldt, Lexington, Medina, Milan, and Trenton. So if you are living in West Tennessee, we have 14 convenient locations for you.